Breaking news coming out of Ethiopia today, as the Ministry of Health has just confirmed an outbreak of a mysterious hemorrhagic fever in Jinka town, located in the South Ethiopia Regional State. This is a developing situation, so let's break down everything we know so far. According to an official statement released on Wednesday, health authorities have identified 8 suspected cases of this hemorrhagic fever. Now, what does hemorrhagic fever mean? It's a general term for a severe illness often caused by a virus that can damage the body's vascular system and lead to bleeding. Or hemorrhaging. You might have heard of diseases like Ebola or Marburg, which fall into this category. However, and this is a crucial point, the specific type of virus causing this outbreak in Jinka has not yet been identified. In response to this alarming development, the Ethiopian Ministry of Health has taken swift action. They've deployed a rapid response team to Jinka. This team is on the ground right now with several critical missions. First, they need to figure out the exact cause of this outbreak. This involves collecting samples from the affected individuals and sending them for detailed laboratory analysis, identifying the specific virus is paramount because it dictates the treatment, containment strategies, and overall public health response. The second major task for the rapid response team is to prevent the disease from spreading any further. Containment is key in any outbreak situation, especially with a disease that shows hemorrhagic symptoms. The ministry stated, and the quote, the ministry, in collaboration with partners, is undertaking coordinated surveillance and response activities. This isn't just a government effort. It involves partnerships, likely with international health organizations, to bring in all the necessary expertise and resources. So, what do these response activities look like on the ground? The statement highlights several key actions. They've intensified community-level monitoring. This means health workers are actively looking for new cases within the community, not just waiting for sick people to show up at a clinic. They are also conducting rigorous contact tracing. This is a meticulous process where they identify every single person, WHO may have come into contact with one of the suspected cases. These contacts are then monitored for symptoms to catch any new infections as early as possible. Finally, they're doing house-to-house case finding, which is a proactive method to ensure no potential case is missed. It's a comprehensive, both on-the-ground public health strategy aimed at tackling the outbreak and stopping it in its tracks. Now, let's talk about the symptoms. The ministry has issued a clear advice to residents in and around Jinka. They are urging anyone who experiences certain symptoms to seek immediate medical attention. These symptoms include unexplained bleeding, which is a hallmark of hemorrhagic fevers. This could be bleeding from the nose, gums, or other parts of the body. Other key symptoms are a high fever, diarrhea, and vomiting. If you or anyone you know in the area experiences this combination of symptoms, the official advice is to get to a medical facility without delay. Early diagnosis and treatment are often critical for a better outcome. Alongside this, there's a strong emphasis on public hygiene. The ministry is advising everyone to maintain strict hygiene practices. This includes simple but incredibly effective measures like regular aseo and washing with soap and water. They are also advising people to avoid direct physical contact with anyone. WHO is showing symptoms of the illness. These diseases can often spread through contact with bodily fluids, so minimizing contact is a crucial preventative measure. The response isn't just happening in the community. It's also being ramped up within the healthcare system itself. Health facilities across the entire region have been put on high alert. They've been instructed to strengthen their patient screening processes. This means when someone comes into a clinic or hospital, staff will be specifically looking for the telltale signs of this fever. If a suspected case is identified, protocols are in place to immediately isolate the patient. This is vital to prevent transmission within the healthcare setting, protecting both the patients and the healthcare workers themselves. And, of course, these facilities are required to promptly report any new suspected infections to the central health authorities so the bigger picture of the outbreak remains clear and up to date. So, to recap the current situation, we have 8 suspected cases of an unidentified hemorrhagic fever in Jinka, Ethiopia. A rapid response team is on site, working to identify the virus and contain the spread through intensive surveillance, contact tracing, and community outreach. The public has been advised on key symptoms to watch for and crucial hygiene practices to adapt. The regional healthcare system is on high alert with protocols for screening, isolation, and reporting firmly in place. The big question on everyone's mind is, what is this virus? The samples are currently being analyzed, and the Ministry of Health has promised to provide further updates as soon as those laboratory results are available. This is episode sepasal that will determine the next steps. Knowing the specific virus will tell us more about its transmission, its severity, and the most effective ways to combat it. Is it a known virus, or could it be something new? We simply don't know yet. The world has become much more aware of the dangers of infectious disease outbreaks in recent years. And the response in Ethiopia reflects lessons learned globally. A rapid, coordinated, and transparent response is the best defense we have. Sections being taken from the high-tech level analysis to the simple act of promoting and dosing are all essential components of a modern public health response for the people of Jinka and the surrounding region. This is undoubtedly a time of great concern. The key is to follow the guidance from health officials, stay informed through reliable sources, and not panic. The authorities seem to be taking this very seriously and are implementing the right measures to protect public health. We will be monitoring this story very closely. As soon as the Ministry of Health releases the laboratory results or any new information, we will bring you the updates right here. It is a reminder of how interconnected our world is and how vital strong public health systems are for everyone, everywhere. Let us hope for the best for the people affected and for us with 10 successful containment of this outbreak. Thank you for watching. If you found this report informative, please like this video and subscribe to the channel for more updates on this and other important global news. Stay safe and we'll see you in the next report.